Asthma is a chronic respiratory condition that affects millions of people worldwide. While genetics play a role, many risk factors for asthma can be managed or reduced through evidence-based strategies. In this video, we'll explore practical steps you can take to lower your risk of developing asthma or experiencing severe symptoms. By understanding what increases your risk, you'll be better equipped to make informed decisions about your health and environment. Let's start by looking at what asthma is and why risk reduction matters for everyone, especially those with a family history or early symptoms. Asthma is a condition where the airways in your lungs become inflamed and narrowed, making it hard to breathe. Symptoms can include wheezing, coughing, chest tightness, and shortness of breath. Asthma attacks can be triggered by a variety of factors, and while some people outgrow childhood asthma, others may develop it later in life. Understanding the basics of asthma is the first step to managing risk. Let's move on to the most common risk factors and how you can address them. One of the strongest risk factors for asthma is family history. If your parents or siblings have asthma or allergies, your risk is higher. While you can't change your genes, being aware of your family history helps you and your healthcare provider monitor for early symptoms. Early intervention can make a big difference in managing asthma and preventing complications. Next, let's look at environmental factors you can control. Exposure to tobacco smoke, especially during pregnancy or early childhood, is a major risk factor for developing asthma. Secondhand smoke can irritate the airways and increase the likelihood of asthma attacks. If you smoke, quitting is one of the best things you can do for your respiratory health. If you're around smokers, encourage smoke-free environments at home and in public spaces. Let's see how air quality also plays a role. Poor indoor air quality is a significant contributor to asthma risk. Common indoor pollutants include dust mites, pet dander, mold, and chemicals from cleaning products. To lower your risk, keep your home clean and well ventilated. Use air purifiers if needed, and avoid using harsh chemicals. Regularly wash bedding and vacuum carpets to reduce dust and allergens. Next, let's talk about outdoor air pollution. Outdoor air pollution, such as smog, vehicle emissions, and industrial pollutants, can trigger asthma symptoms and increase the risk of developing asthma. On days when air quality is poor, try to stay indoors and keep windows closed. Use air quality apps to monitor pollution levels in your area. If you need to be outside, consider wearing a mask to filter out pollutants. Now, let's look at how allergies are connected to asthma risk. Allergies to pollen, dust mites, animal dander, and mold are closely linked to asthma. Managing allergies can significantly reduce your risk of asthma attacks. Use allergy-proof bedding, keep pets out of bedrooms, and clean regularly to minimize allergens. If you have seasonal allergies, talk to your doctor about medications or immunotherapy. Next, let's discuss respiratory infections and their impact on asthma risk. Frequent respiratory infections, especially in early childhood, can increase the risk of developing asthma. Viruses like RSV and influenza are common culprits. To lower your risk, practice good hand hygiene, keep vaccinations up to date, and avoid close contact with sick individuals. If you or your child develops a respiratory infection, seek prompt medical care to prevent complications. Now, let's look at the role of exercise and physical activity. Regular physical activity is important for overall health, but intense exercise can sometimes trigger asthma symptoms, especially in those with exercise-induced asthma. Warm up before activity, avoid exercising in cold or polluted air, and follow your doctor's advice on managing symptoms. Staying active can actually help improve lung function and reduce asthma risk when done safely. Next, let's discuss obesity and its connection to asthma. Obesity is a well-established risk factor for asthma. Excess weight can put pressure on the lungs and increase inflammation in the body, making asthma symptoms worse. Maintaining a healthy weight through balanced nutrition and regular exercise can help lower your risk. If you're struggling with weight management, seek support from healthcare professionals. Let's move on to occupational exposures. Certain jobs expose workers to dust, chemicals, or fumes that can increase asthma risk. If you work in construction, cleaning, manufacturing, or agriculture, take steps to protect your lungs. Use personal protective equipment, follow safety protocols, and ensure proper ventilation in your workplace. If you notice symptoms at work, report them to your employer and seek medical advice. Now, let's talk about the importance of early childhood interventions. Intervening early in childhood can help reduce the risk of developing asthma. Breastfeeding, for example, has been shown to lower asthma risk in some studies. Limiting exposure to tobacco smoke, allergens, and respiratory infections during infancy is also crucial. Creating a healthy environment for children sets the foundation for lifelong respiratory health. Next, let's look at the role of diet and nutrition. A balanced diet rich in fruits, vegetables, and omega-3 fatty acids may help reduce inflammation and lower asthma risk. Some studies suggest that antioxidants and vitamins found in fresh produce support lung health. Avoiding processed foods and maintaining a healthy weight are also important. Consult a nutritionist if you need guidance on creating an asthma-friendly diet. Now, let's discuss the impact of stress on asthma. Chronic stress can worsen asthma symptoms and may even increase the risk of developing asthma. Stress hormones can cause inflammation and make the airways more reactive. Practice stress management techniques such as mindfulness, meditation, or regular exercise. If you find stress difficult to manage, seek support from mental health professionals. Next, let's look at the importance of regular medical checkups. Regular checkups with your healthcare provider can help detect early signs of asthma and monitor your lung health. Early diagnosis and treatment are key to preventing severe symptoms and complications. Your doctor can also help you identify personal risk factors and develop a tailored prevention plan. Now, let's discuss the importance of vaccinations in asthma prevention. Vaccinations, especially against influenza and pneumonia, are important for people at risk of asthma. These vaccines help prevent respiratory infections that can trigger or worsen asthma symptoms. Make sure your vaccinations are up to date and consult your doctor about any additional vaccines you may need. Next, let's talk about the role of pets in asthma risk. Pets can be a source of allergens, especially for people with a genetic predisposition to asthma. If you're at risk, consider limiting pet access to bedrooms and using HEPA filters to reduce dander. Regular grooming and cleaning can also help. If you notice asthma symptoms around pets, consult your healthcare provider for advice. Now, let's look at the importance of reducing exposure to mold. Mold and damp environments are known asthma triggers. To reduce risk, fix leaks promptly, use dehumidifiers, and ensure proper ventilation in bathrooms and kitchens. Clean visible mold with appropriate products and avoid carpeting in damp areas. Keeping your home dry and mold-free is a key step in asthma prevention. Next, let's discuss chemical exposures at home. Many household cleaning products and air fresheners contain chemicals that can irritate the airways and increase asthma risk. Choose fragrance-free or natural cleaning products whenever possible. Always use chemicals in well-ventilated areas and store them safely out of reach of children. Next, let's talk about the importance of hand hygiene in preventing respiratory infections. Good hand hygiene is essential for preventing the spread of respiratory infections that can trigger asthma. Wash your hands regularly with soap and water, especially after being in public places or touching shared surfaces. Teach children proper hand washing techniques to protect the whole family. Now, let's look at the role of humidity in asthma risk. Both high and low humidity can affect asthma risk. High humidity encourages mold and dust mites, while low humidity can dry out airways. Aim to keep indoor humidity between 30% and 50%. Use humidifiers or dehumidifiers as needed, and monitor humidity levels with a hygrometer. Next, let's discuss the importance of avoiding strong odors and fumes. Strong odors from perfumes, paints, and cleaning products can irritate sensitive airways and trigger asthma symptoms. Choose unscented or low-odor products and ventilate rooms well when using paints or chemicals. If you're sensitive to odors, avoid places with strong smells whenever possible. Now, let's look at the importance of regular cleaning routines. Keeping your living space clean helps reduce dust, pet dander, and other allergens that can trigger asthma. Use a vacuum with a HEPA filter, dust surfaces regularly, and wash bedding in hot water. Avoid clutter, as it can collect dust and make cleaning harder. Next, let's discuss the importance of bedding and mattress choices. Dust mites thrive in bedding and mattresses, making them a common source of allergens. Use allergen-proof covers on pillows and mattresses, and wash all bedding weekly in hot water. Replace old pillows and mattresses as needed to minimize allergen buildup. Now, let's talk about the importance of avoiding unnecessary antibiotics. Overuse of antibiotics, especially in early childhood, has been linked to an increased risk of asthma. Antibiotics can disrupt the balance of healthy bacteria in the gut, which may affect immune system development. Only use antibiotics when prescribed by a healthcare professional and never for viral infections like the common cold. Next, let's discuss the importance of breastfeeding in asthma prevention. Breastfeeding has been shown to reduce the risk of asthma in children, possibly by supporting immune system development and reducing exposure to allergens. If possible, breastfeed exclusively for the first 6 months. If breastfeeding isn't an option, consult your pediatrician for alternatives that support immune health. Now, let's look at the importance of avoiding unnecessary medications. Some medications, such as certain pain relievers and beta blockers, can trigger asthma symptoms in sensitive individuals. Always inform your doctor about your asthma risk before starting new medications. Read labels carefully and report any side effects promptly. Next, let's discuss the importance of staying informed about asthma triggers. Everyone's asthma triggers are different. Common triggers include pollen, dust, smoke, exercise, and stress. Keep a diary to track your symptoms and identify patterns. Share this information with your healthcare provider to develop a personalized asthma management plan. Now, let's look at the importance of community and social support. Having a strong support system can make managing asthma risk easier. Friends, family, and support groups can provide encouragement and practical help. Share your asthma action plan with those close to you so they know how to assist in an emergency. Next, let's discuss the importance of staying informed about asthma research. Asthma research is constantly evolving, and new prevention strategies are being developed. Stay informed by following reputable health organizations and discussing new findings with your healthcare provider. Being proactive about your health empowers you to make the best decisions for asthma prevention. Now, let's look at the importance of emergency preparedness. Even with the best prevention, asthma attacks can still happen. Have an emergency plan in place, including quick access to inhalers and emergency contacts. Make sure family members and coworkers know what to do in case of an asthma attack. Next, let's discuss the importance of regular follow-up appointments. Regular follow-up appointments with your healthcare provider help ensure your asthma prevention plan is working. Adjustments may be needed as your lifestyle or environment changes. Don't hesitate to ask questions or discuss concerns during these visits. Now, let's look at the importance of school and workplace accommodations. If you or your child has asthma, inform teachers, school nurses, and employers about your condition. Provide them with a copy of your asthma action plan and ensure quick access to medications. Supportive environments can help prevent asthma attacks and reduce anxiety. Next, let's discuss the importance of avoiding unnecessary exposure to cold air. Cold air can trigger asthma symptoms in some people. If you're sensitive, wear a scarf over your mouth and nose when outdoors in cold weather. Try to breathe through your nose to warm the air before it reaches your lungs. Now, let's look at the importance of avoiding strenuous activity during high pollen or pollution days. On days with high pollen counts or air pollution, limit outdoor activities, especially strenuous exercise. Check local air quality and pollen forecasts before planning outdoor events. If you must be outside, take preventive medications as prescribed and shower after returning indoors. Next, let's discuss the importance of sleep and rest. Good sleep is essential for overall health and can help reduce asthma risk. Poor sleep can weaken the immune system and increase inflammation. Maintain a regular sleep schedule, create a comfortable sleep environment, and address any sleep issues with your doctor. Now, let's look at the importance of hydration. Staying well hydrated helps keep mucus in the airways thin, making it easier to breathe and reducing the risk of asthma symptoms. Drink plenty of water throughout the day and limit sugary or caffeinated beverages. If you have trouble staying hydrated, set reminders or carry a water bottle with you. Next, let's discuss the importance of avoiding unnecessary fragrances. Fragrances in personal care products, air fresheners, and cleaning supplies can trigger asthma symptoms. Choose fragrance-free or hypoallergenic products whenever possible. If you're sensitive, avoid areas where strong scents are present. Now, let's look at the importance of regular monitoring and self-assessment. Regularly monitor your symptoms and peak flow readings if recommended by your doctor. Early detection of changes can help prevent severe asthma attacks. Keep a log of your symptoms and share it with your healthcare provider during appointments. Next, let's discuss the importance of avoiding unnecessary stress on the immune system. Supporting your immune system can help lower asthma risk. Eat a balanced diet, get enough sleep, manage stress, and stay physically active. Avoid unnecessary antibiotics and practice good hygiene to prevent infections. Now, let's look at the importance of environmental awareness. Being aware of your environment helps you avoid asthma triggers. Pay attention to air quality, humidity, and potential allergens at home, work, and school. Make adjustments as needed to create a safer space. Next, let's discuss the importance of advocating for clean air policies. Supporting clean air initiatives in your community can help reduce asthma risk for everyone. Advocate for policies that limit pollution, support green spaces, and promote healthy environments. Your voice can make a difference in creating safer, healthier communities. Now, let's look at the importance of ongoing education. Asthma prevention is an ongoing process. Stay educated about new research, prevention strategies, and treatment options. Attend workshops, read reliable sources, and discuss updates with your healthcare provider. Knowledge is power when it comes to managing asthma risk. Next, let's summarize the key points from this video. To lower your risk of asthma, focus on avoiding tobacco smoke, managing allergies, maintaining a healthy weight, and keeping your environment clean. Practice good hygiene, stay active, and keep up with medical checkups and vaccinations. Remember, prevention is a lifelong commitment, and small changes can make a big difference. Finally, let's wrap up with a message of empowerment and hope. Lowering your risk factors for asthma is possible with evidence-based strategies and a proactive approach. By making informed choices and working with your healthcare team, you can protect your respiratory health and enjoy a better quality of life. Remember, every step you take counts. Stay empowered, stay informed, and breathe easy.